So you are a super medical provider in my mind.
I mean, in my mind, I think I'm just a very flexible doctor, right? And so everybody is different. Everybody's priorities are different. Some patients opt more for the natural approach, the conservative approach, while other patients are so, their lives are so full and they're so busy that really they're like, I just need to feel better now. And that Western medicine, honestly, sometimes is easier for that. And so it's, a bridge, a temporary management. But in the long run, I still try to push for the more natural route, because ultimately that helps to prevent these symptoms or reduce symptoms and not just put a Band-Aid on it. And so yeah, it's more, having the integrative fellowship under my belt, it's just more tools and resources to help the patient kind of achieve the health that they want.
Mm-hmm. And the way I look at it is conventional medicine is very good at diagnosing and curing. So let's say, for instance, cancer. It's really good at finding out that you have cancer, chemotherapy, getting rid of it. But the Chinese way of the approach is to look at the whole person and find out, why did this happen, and let's try not to let this happen again. And so maybe you can speak to that a little bit of the Chinese approach.
Yeah, I mean, Western medicine saves lives, no doubt. You break a hip, they will, put it back together. You have, really bad infection in your septic, it will save your life.
You want that.
Yes, you
You
need
want
that.
it when you
You
need it.
absolutely need that.
Yeah.
But Chinese medicine is looking deeper at the root or the why, right? Western medicine tells you what it is, but it doesn't necessarily tell you or explain why. Whereas Chinese medicine is getting to, where is it coming from? How do we rebalance the system? How do we use natural methods like our diet or our lifestyle to help modify and rebalance the system so that your symptoms don't come back, right? And from the cancer standpoint, it's the same. We use Western medicine. For my patients who have cancer, get your chemotherapy, but then at the same time, empower the patient to really look at what kind of imbalances may be creating or causing more of this inflammation that ends up leading to cancer, and how can we prevent it from coming back, or how can we optimize your health during your treatment so that you can actually have the best chance of completing your chemotherapy course.
So if you liked that clip, subscribe to our YouTube channel to watch the full episode and for more clips.